The navigated total knee replacement by Dr Munjed Al Muderis. Patient x-rays are templated to give the surgeon an estimate of the size of the implants which will be used during the operation. The undersurface of the patella is prepared. A trial patellar implant is inserted. Osteophytes are removed from the distal femur. And navigation instruments are set and aligned for careful calibration with the navigation unit. Navigation feedback allows the surgeon to perform the first cut, which is of the proximal tibia. Cuts are measured for accuracy against the navigation before gap management commences in both extension and flexion of the knee, allowing the surgeon complete control of ligament stability throughout the operation. A femoral trial implant is measured against the end of the femur for size, and once the correct size has been chosen, under navigation, the first of the cuts can be made, examined, and used to set up the cutting block for the additional cuts required for the implant. Once completed, the bones are washed and further preparation of the tibia before the trial implants are inserted. And a test under navigation of the range of motion confirms the sizing of the implants chosen. The femoral notch is completed, trial implants removed, bones are washed, cement prepared, and actual implants inserted, commencing with the tibia, the meniscus, the femur, and finally patella implants. Once inserted, the surgeon performs a range of motion test under navigation to confirm that everything's in order and to conclude the operation.